Here I am.
There you are. I'm so happy that you're with us. Thank you for coming.
My pleasure.
Um, People are trickling in, so we'll give them another minute. Are you okay if we record this?
Yes, absolutely.
Okay.
As long as you promise to distribute as widely as possible.
Super wide. All of our comms people are here.
I'm gonna grab something very quickly.
Okay. Okay, there you are. Should we get started?
Sure.
Well, I'm so happy to meet you. I'm Megha. Thank you for doing this for us. And even more delighted to introduce you to the audience. This is Alejandro Varela, a graduate of our own community-oriented public health practice program, the 2023 recipient of the University of Washington School of Public Health Alumni of Impact Award, author of 3 books, 2 of which were National Book Award finalists. You're an author, editor, and educator extraordinaire, and I have a super intellectual crush on the characters in your books, and can't wait to talk to the person who wrote those characters. So thank you so much for coming.
Thank
And
you,
I'll pass
Megha.
it to you. I think you're going to give some comments about your journey through public health and fiction, and then I've got some questions for you.
Yeah, great. Well, thank you, Megha, for having me. It's really a pleasure to meet you too. Love your background. I don't know that painting, but it's gorgeous. Um, I let's see. It's funny. I just want a really quick anecdote. I had no idea what to expect for that Alumni Impact Award, and I thought I was the opening act for someone else, and I didn't realize until I got there and my face was on the program. And I'm telling you, I got so nervous because I wasn't expecting the crowd either. It's fine. It's fine. I need these moments, but that's good cortisol because it's temporary. And I remember just before Hillary read my name, I was like, I have to go to the bathroom. And she's like, what? And I got up and left, and I didn't have to go to the bathroom. I just circled sort of the bowels of the Alaska Airlines anyway, auditorium or arena or whatever that is. But that was an amazing experience. So I'm grateful to be back and to do anything with the School of Public Health, where I had really sort of a life-changing, formative few years. And I'm happy to be back in this capacity. So yeah, so I moved to Seattle because my partner at the time, he's still partner, but husband now, was in search of uh, paperwork at what's the word? A visa, a work visa. And at the time, Amazon wasn't as evil as it is now. And he got a job out there. And so I moved not knowing anything about Seattle, from having lived in New York City all my life. And it was a bit of culture shock. And I thought I'm going to go and study international relations. And so I went to the University of Washington. And actually, on day one, I went straight to establish a bank account and to get my driver's license so that when I applied to programs a year later, I could have in-state tuition. And that worked. And so, yeah, and so then the ways we have to game the system just to get ahead. Anyway, and so then I went to get an international relations program or pamphlet or something, and they said, we don't offer one just for international relations. You'd have to either pair it with an MPH, an MPA, a JD, or an MD, because it's a sort of a general studies master's. And so if you don't focus on one particular region in the world. So I went to all of the departments. Well, that's a lie. I made appointments at all of the departments to see which program, because I was 23 and I thought I could be anything, doctor, lawyer, and it doesn't matter. I didn't know what an MPA or an MPH were. And so I went and I met with Alice, whose last name I'm forgetting, but I saw Bud on here, and I'm sure he'll remember. Um, Alice did the administrative work and did a lot of recruitment for the co-PHP program, the Community Oriented Public Health Practice Program. And when I met with her, she said, this is the program for you. You have to apply to this. And so then I just spent a week or two reading everything I could about public health. Don't ask me what. Some of it was just, kind of superficial stuff on the internet. I asked questions. I met with her one more time. And then I realized that in some ways, what was being described to me as a public health worker or a health communicator was what I'd been all my life. Like this child of immigrants for whom the US was a second culture, English a second language. I think I had spent all of my youth trying to keep my family healthy, but by translating the world to them or interpreting it for them. And um, and so yeah, so and then when I got into the program, I thought, yeah, this is a continuation of sort of who I am as a person, and then sort of my passions, my political passions, and I was lucky to cross paths with a lot of great educators there. And I'm going to name drop a few. Um, Carolyn Watts, Sharin Shu Thornton, Amy Hagopian, Karen Hartfield, and Stephen Bezrushka, and of course Bud and Fred, everyone. But um, I learned a lot, not just about the world, but from a lot of those, how to be a better writer. Amy Hagopian and Carolyn Watts are spectacular writers, and so they really edited my work, and that was a lot of fun. And then from Stephen and Bud, we learned about the damage that hierarchy causes. And so I once I learned that, it was like seeing the Matrix, right? You couldn't unsee it, and you saw the ways in which I we could devote our lives to all of the different aspects of public health or focus on a particular illness, but what they all had in common was chronic stress and the ways in which our society organized itself to make each of those conditions worse, each epidemic worse, each sort of, I don't know, risk factor worse. And I graduated and I got a job. I got several jobs. I moved back to New York, which is almost never a good idea to get your public health degree in one city and then move to another because every contact, every in you have at a health department, at a CBO, whatever it is that you have been working with for the last couple of years sort of vanishes in a way. And so in New York, I felt like I was starting from scratch, even though I was from New York originally. And I worked recruiting. I would go to gay bars at night and recruit for HIV/AIDS studies. I've worked for the New York City Blood Center, which is imagine just being a buzzkill in human form. You have all of these men socializing, and you walk in and you're like, does everybody remember AIDS? I want to talk about AIDS. And so that was painful because my shifts were from like 9 p.m. to 2 in the morning. And then I got a job at Mount Sinai School of Medicine in their oncological health department. And I worked on colorectal cancers and cervical cancers and breast cancers, looking at the health behaviors of the Black and Latino populations in East Harlem. And also great, but working for a large I bet it was great and wonderful to use my public health skills, but still felt like a lot of what I wanted. I mean, when can we talk about hierarchies? That's really what I kept thinking. When can we talk about cortisol and adrenaline and how when it becomes chronic, the wear and tear gets worse sooner. And so then I worked with iTech for a while, which is affiliated or was affiliated with University of Seattle and University of San Francisco. And I went to Namibia and I helped develop a training curriculum for Ministry of Health workers in Namibia and a few other places. But it was contract work. And then I started teaching at Long Island University in the graduate program, policy advocacy and leadership in the public health world. And at the time, I had just been sort of fresh off of my involvement in Occupy Wall Street. And so I would bring in a lot of activists and people from ACT UP, people from the Sylvia Rivera Law Project, to sort of show how policy could be crafted from the bottom up, from the sides, through the courts, and a lot of case studies, and always using problem-based learning, which was cemented in me in what a great and empowering way to educate. And so I did as I was told, and I used that and always found a way to talk about the research of Wilkinson and Sapolsky and the ways in which hierarchy affected all animals, not just humans. And still, it wasn't enough. I thought, okay, so 33 people a semester are going to learn about how bad hierarchies are for you. And so then what I would have them do as a project was each of our case studies, for one case study every semester, they would each have to write an op-ed. And then we would blanket every periodical in the tri-state area. So 33 op-eds would go out about decriminalizing HIV, for example. And not all of them would get published, but they weren't expecting to be trying to publish work anyway, but it was really great. And we would partner with organizations who were working on those projects or campaigns. And in the process of it, I thought, here I am editing people's writing. I've never published an op-ed before. What am I doing? I've never done that before. So I wrote a couple of op-eds and they got published. And I thought, okay, so I found my lane here. I will write op-eds and teach, and then on the side do these other projects. And no shade to the op-eds, which can be transformative and life-changing, but I realized, oh, the New York Times alone has 4 or 5 a day. And and then I thought, multiply that by every major paper, every small paper, every country in the world. And I wondered, do these messages stay? And with whom do they stay? And for how long do they stay? And one the things that have most resonated with me, in what medium did they come? And for me, it was narrative. It was song, it was film, it was television. Um, so I crafted a film and public health class at the Long Island University, and we would talk about the different ways in which the social determinants of health appeared in all these films. Um, and then I thought, I'm going to write a screenplay, and I sat down to write a screenplay, but I didn't know how to format it. So it became a short story, and it was called Crime in the 21st Century, and it got published. And then I got an agent, and I wrote another 30 stories, and then short stories don't sell well in the publishing industry. So they said, "Where's your novel?" And I thought, I don't write novels. I like short form. And they kept pushing and pushing and pushing until finally I was told, "You'll get a deal if you write a novel." So there was this story about Roseto, Pennsylvania, which I learned in Bud and Stephen's class, Population Health. And it was about the town, the Rosettans, who live 75 miles west of New York City, Italian immigrants. And what they learned in a nutshell is that because their hierarchy was so flattened, they had less heart disease, or developed less heart disease. And the Rosetto effect is an effect that's still known in cardiological sort of study and practice. And it's about social capital and feeling secure and safe within a community, and how much that buffers you from the slings and arrows of life. And I got to thinking about how my own upbringing in a working class Irish Italian Catholic town on Long Island had um, had influenced me, and how much it resembled Roseto, Pennsylvania. So I took, in effect, my experience on the South Shore of Long Island, the people of Roseto, Pennsylvania, that I learned about in public health school, and I put them together to tell the story, which became my first book, which is, The Town of Babylon. And the rest is history. Take a break there.
That is an incredible public health story. And I think just what a model for our students, to think about how you translate public health expertise across different mediums and work experiences. So thank you for sharing that. How did you get so good at your craft so fast? I mean, these are like big, important books.
Um, you know, Part of it is, I'm 46. I published my first book when I was 42, 43. And maybe I was 42. And I had 42 years worth of observations, and things that I wanted to talk about. And I feel very strongly that the more marginalized you feel in society, the less you participate in it by design. And so I have always felt a little bit more like an observer. I was the kid in college who didn't want to raise their hand because I was convinced whatever I said was going to be stupid, right? And so, and or that it wouldn't come out right. And I felt that way at community board meetings, at any kind of space where I should have been participating, I was afraid to. And in fact, when I got to the University of Washington, I made a commitment sort of to myself that no matter what, I was going to participate and that I was going to befriend my educators because I hadn't done that in college. And because again, I was just afraid. I was like a fish out of water. And so sort of I would tie that in also to my queerness. I'm a gay, I identify as a queer gay man. And I do think that when you are from a very young age, there are it's just a handful of foundational truths, right? And one of them is boy, girl, make baby, and that is the foundation of society. That's how I was raised, and I think a lot of people of a certain age or who weren't born last week were raised, and so in my 20s or whenever it was that I was like, wait a second, there's nothing wrong with me. I'm healthy. This is just another part of the human experience, and everyone else is wrong. It it makes you think what else are they wrong about? Because if you're so wrong about this, which was essential, an essential truth, then nothing else is sacred. Not the police, not Israel, not abortion, not you name it, some gender norms, you suddenly start to be like, what is this? What is, and that degree of questioning, I think, is the foundation for good art or interesting art because you're constantly questioning why. I also think it's ideal for public health research. It's just constantly why and could this be another way and why isn't it this way? And so and I think in a funny way, it's like why so many people, including someone like my mother, would be like, gay people are so creative, they're so artistic, but there is something to that because we had to question our own existence, and so then everything else is also on the table. And again, I think that goes hand in hand with creation, and especially so. And then writing is a form that really allows you to sort of think, okay, so I'm a creative person, questioning person, and then a good path, like I'm not kidding when I say that having Carolyn Watts and Amy Hagopian really engage with my writing because they could see that I was interested in a good sentence and and in economical communication so that how can we reach as many people as possible with few words. And that's really important in I think PSAs and in health communication. And again, back to being the child of immigrants, it's like, how do I get this across to my mom and dad so that they understand not just the meaning of this, but the entire culture around it? And I think that lends itself to storytelling. So that desire to communicate effectively, to entertain, to be liked, by the way, to be liked, right? And how much what better way than to make someone laugh? And then suddenly like, okay, so they want you around. And so I think it's the same with my words. It's like if I can entertain you um, and enlighten you, then you'll also want the work around, you know. And so I think all of those things. And maybe a little overachiever, middle kid desire to like go to the Ivy League school and get the best grades and be at the top. And so then I am concerned with producing good work, you know?
You do write a beautiful sentence.
Mm,
And one of the sort of beautiful things about the writing is how much vulnerability is on the page. So I have two questions about vulnerability. One is, where is the place you go in your mind or your heart to get that on the page? And then the second part is like, what's the lesson for public health workers there in engaging with that vulnerability?
yeah. So I firmly believe that if anyone, but in writing, if you're vulnerable on the page, the reader is more likely to be vulnerable and to be open. And so that's why I believe that health messaging or when it becomes very personal and when someone can sort of reveal themselves and their journey, then suddenly you're not just prescribing something, you're actually saying, look at what I had to do to get there. And so you serve as an example to someone else. Um, so yeah, when I'm writing, I think I, this is something for me and future therapists to sort of think about, but I do like being honest. I do like sharing. I don't like shame. That might have something to do with coming out or how I grew up socioeconomically. I think shame is a terrible way to be and to live, and it's not a good starting point for anything. And so the opposite of shame to me is always like sort of bold living and honesty. And um, and that goes hand in hand with being vulnerable. Is it always easy? No. Sometimes I sort of have to gulp a little bit and then be like, no, I want this there. And but it is also fiction. Some like if there's a vulnerability scale, I think I live on a 6 or 7, and my narrators sometimes live on an 8 or 9. And I think punching it up is also really helpful. In my latest book, I'll give you an example. I have a child who is non-binary in real life, and in the book, in my fiction recently, I have been wanting to talk about that experience without it being about my child. And I had to grow and learn a little bit because, being queer doesn't mean like you've reached the pinnacle of enlightenment around LGBT issues. And so I had to also grow and learn a little bit and think about um, how to be a better parent and person. It isn't as hard for me as it is maybe for the narrator in my latest book, but I felt like following his arc and making it a little bit more complicated so that he's both fallible, makes him three-dimensional, and it also gives someone who's reading this the room to be like, oh, he's worse than me. Or I I can grow because this character was able to do it too. That crosses my mind when I'm crafting those sort of mini journeys within the larger text.
So, Middle Spoon was one of my favorite books of last year. I
Thank
almost
you.
exclusively read romance. I only consume romance on television, and it is a beautiful romance. And one of the things you do really beautifully as a writer is you sort of, meander through this story of heartbreak in Middle Spoon, but you also do this searing public health critique in both of the books. And so,
Yeah.
like, as a writer, like how do you do that? Like I just kind of found myself, being so enmeshed in the love stories and then being like, oh my God, like
Yeah.
just hammer
Yeah.
the points home. How do you do
Yeah.
that?
Well, I think part of it is I do feel an urgency. I'm not lying when I say this. When people say to me, "What do you do for a living?" I say, "Well, I'm a public health worker, but my medium is fiction." And some people buy that and some people don't, but I do mean it. And I feel empowered from my education to take public health in any direction that I can um, because that's what targeting and tailoring messaging was about. We were supposed to be creative in how we got the information out there. And this allowed me to bring together my two passions. And so, anyway, I feel an urgency to everything I'm doing. And there was a time when the novel of ideas was more common. I didn't live through that time and I'm not well versed in it, but where you could speak politically about anything for 300 pages and build a story around it or build that around a story, and it was acceptable and it was a part of culture and popular and mainstream. And narratives have gone in a different direction. That is not what I don't have an MFA, but I know this from other people. MFA programs tend to push people into showing and not telling. And and I think that when done right, it could be beautiful and accomplish similar things. But the urgency with which I feel about like the inequities in our society means that um I have to tell because sometimes if you take too long to, there's only so many contours on an autumn leaf that I can detail for you. I really, really, really want to talk about hierarchies and all these other things. So my narrators in that way are, alter egos of mine. And I get to and I think this is quite real. The narrator in Middle Spoon is dealing with heartbreak. Um, but he doesn't stop being a person who lives in society, and he has children, and he has a life, and he has concerns about the sanitation department and the motion picture arts and sciences and the New York Times and how they report issues. And so it it strikes me that that is how a brain works, and you're constantly juggling and spinning dishes. And so you do jump from like this is the worst pain in my life to I'm madly in love to we need a higher minimum wage. And so how can I do that in a way that entertains people and keeps you doesn't remove you too far from the narrative. So that is my challenge when I'm writing. It's like, how do I get to continue talking about these things in a way that will keep the reader's attention? Um, and that is the struggle. And I don't always hit the mark. And the first draft is always much more tell than show. So as I'm writing, I'm like, okay, all right, pull back a little, Alejandro. Like, give your audience some credit, bring them to water. You don't have to like feed them. Um, so yeah, but it's both a way to like be true to myself and what my worldview is, and it's a way to undercut some of the other stuff happening. They work in tandem, you know. I'm happy to hear that you view the book as a romance. I do too, as a love story that is, um, but for some people there might be too much love story, especially the lovelorn character, you know, who's in so much pain. There's only so much, you know, there's nothing more selfish than heartbreak. It's beautiful, but it's painful and it's selfish and it's hard to be around for eternity. And so it's nice to undercut that with other things. And I think the sociological stuff and the perspectives, the digressions, they appear both for the reasons I just said, but my hope is that they tie back in, you know, that they always have a kind of a link to the part of the story so it doesn't feel sort of shoehorned.
Yeah, thank you for that. I mean, I'm trained as a sociologist and we talk about show, don't tell. But I think what makes your writing so effective is the telling at the end.
Thank you.
Um,
Thanks.
so I love longing. I felt like that book, Middle Spoon, was written for me. You are a master of heartbreak as an area of inquiry. And I think you even joke in the book about, a science of heartbreak. What would that look like, wanting it? So I want to ask you, what would a public health science of heartbreak look like?
Well, um, in that chapter, when I go into that, that book is a series of unsent emails, right? They're draft emails, and this one is to the National Institutes of Health, where he's proposing a study in which we look at the way heartbreak affects people. And what he hypothesizes is that, like most other adverse events in one's life, they are harder to deal with the worse off you were at the start. So everything gets worse if you started worse. And my argument is that I believe there are kind of two types of people in this world. Those that when things get really stressful, they're vacuuming and the vacuum cleaner breaks down. Those who kick the vacuum cleaner in frustration, and then those who go to the computer and say, well, I can't find the instructions, but I'm going to download the PDF and I'm going to see how to fix this thing. And I come from a long line of vacuum kickers. And so um, and it falls in line with what I do believe happens to the brain around attention and stress, both in utero, generationally, and then in the early years or the early days of life. How much attention did you get? How did things form around the brain? Which parts developed correctly, which didn't? And wait, I lost my train of thought. Your question was?
What does the public health science of heartbreak look
Right.
like? You're right
So
on
then
track.
I, right. So then I thought when I wanted to write about heartbreak, I thought there are people for whom heartbreak is you walk down the street and you're sobbing and like uncontrollably, and it's also painful, and then you feel better for a minute and then it gets worse. And there are some people who are like, this is a really shitty time. And they become introspective and maybe they cry one day and then after a few weeks they move on. And I have this sinking suspicion that for the first category, they handle other stressful events in life more difficult in a more difficult way too. And if we draw a thread between that experience and then the hierarchy in society, then I do believe. And so the letter is like, let's do a multi-site study that's global, and it should have participants in every region in the world. And then we would see, do the people in China and Cuba feel it the same way as the people in Denmark and Spain? And do they feel it the same way as the people in the United States and Australia, you know? And so we kind of look at the spectrum of capitalism, the spectrum of communism, the spectrum of hierarchy, and then this is probably never going to happen because we obviously have more pressing and unfortunately delusional concerns in our life. But um, but if we did, I'm going to go on a limb and say that heartbreak is worse the more uneven a society is. That
Mm.
heartbreak is worse in income unequal societies.
Do you think public health workers connect more with love and heartbreak than other people? Is that our downfall or our greatest strength?
Wow. Yes and yes. I think I never thought about it that way, to be honest with you. And but I think hmm, maybe like more the health communicators and the epidemiologists and the biostatisticians. I'm kidding. Sorry. I'm sure everyone feels it. But yeah, I think the nature of our work is that we are seeing a lot of unfair and unnecessary suffering. And it is a kind of like an unrequited love with society, like
Mm.
where there are lots of populations who are just not getting the love that they deserve, that they so desperately want in a lifetime. And that plays out in like lack of resources, lack of attention, more oppression, all of the things that make society unhealthier. Um, so yeah, do we have more, even if we don't come from that experience, do we witness it more? Do we have more stories to tell and more experiences that could add up to those? Yeah, I think so. There's something to that. But maybe not as much as nurses. But then again, that falls in the realm of public health. So yeah.
So it's been a really hard world in the last, even just week,
Yeah.
year, 2 years, 3 years.
Yeah.
Um, how do you keep up a love practice, a vulnerability practice in a bad, bad world?
Mm. Um, well, I realized that in my lifetime, I was never going to see the flattened, this flattened organizational structure that would make the United States healthier. I'm never going to live that, and that kind of makes me. That's a bummer because I know it's going to be a better life for everyone, and so the fact that I won't see it in my lifetime, maybe I'll see it a little bit more in a Mamdani, New York City, um, but the changes that would need to happen, and so I try to recreate that. I have, I'm not kidding, 3 to 4 dinner parties a week. We have friends over as much as we can. I know that we are faking it. We're doing our best to recreate the tight-knit society in our kitchen and in our living rooms, in a way that like I don't always feel outside. And it's so intentional. I like being around people and I like community, but um, knowing that and that would make society better. So yeah, so we're taking a little shortcut and it helps to kind of be somewhere in the middle of the socioeconomic spectrum too, you know. So we have the sort of the resources to do that. But that's how I kind of stay sane and vulnerable and healthy and happy, is just surrounding myself with people and feeling like, okay, and I laughed today. That's important. I laughed with them and they laughed with me. And so that goes a very long way.
Thank you. What are your top three books, movies, or shows that you recommend to us? What are you really into right now?
Um, ooh, I just watched with my kids Pretty in Pink, 1987. And I loved it. I watched it in my youth and I thought it was great, and I didn't think it would hold up. We were just trying to find like a family-friendly film or something, and they loved it. Everybody loved it. So that was great. I know that's probably not what you're expecting, so I threw that out there. Um, I recently read, what did I read that I love? The French writer Annie Arnaud, The Years. She won the Nobel a few years back, and I had no idea who she was before that Nobel Prize. And then she writes very short um, biographical fiction, and she chronicles the history of France, essentially, her lifetime in France, in these very short episodes. And they're beautiful, beautiful chronicles of life. The Years was the last of hers that I read. And then I fell onto, I'm on the Heated Rivalry bandwagon. So I recommend it to everyone, and it's totally fun and sexy and beautiful.
So for a couple of us on this call, that's one of our favorite topics. Can you give us like, I don't know, your public health critique of heated rivalry?
Oh my God. Um, no, I cannot, but I will tell you that because I don't know what it would be. Um, it's just so nice to see people enjoying life in a way, even and overcoming a kind of an unfortunate circumstance and really making the best of a shitty structure, which is society. And to see that. And I think maybe now I have felt like a young person until very recently. And I know it's all relative, but I'm also vicariously loving this youthful love that they have. And it's so nice to see young people enjoying themselves. And for those people who really fan out on that show, I find their press tour as exciting and invigorating as the show itself. It's just people enjoying life and caring about each other, and it's very heartening.
Thank you. All right, I'd love to open it up to our audience if you all want to put cameras on and ask questions.
So curious if I know anyone on here.
Well, your fans are here, and you asked about my beautiful art. Amy Hagopian's mother did this.
Oh my gosh, that's amazing. That's so great.
Questions, anybody? Old friends of Alejandro's want to show themselves?
I was wondering how you make
I'm
the
not an
time.
old friend.
Oh, sorry.
Oh, sorry. I was going to say you and I loved it, and I was so happy to see you're speaking here, and I'm also happy to be able to be here and listen to you again.
Oh, thank you. I
was wondering how you make the time to work on creative projects amid also being a public health scientist.
Well, um, I had misled you because my full-time public health work is writing nowadays. And actually, today was my first day of teaching in 10 years at CUNY. I'm teaching in their journalism school and their creative, uh, it's not a journalism class, it's a fiction class, but it's housed in their journalism school. So I've had a lot of fun this last month coming up with a syllabus, and I haven't had to do that in 10 years. But I do have two kids, and they feel like a full-time job sometimes. And I get up very early in the morning, and I write anywhere and everywhere. And I probably spend too much time on the toilet with my laptop. If TMI, but it's true.
I love to know the tips and tricks, so thanks for that.
I saw Amy. Amy doesn't know how to raise her hand, she said.
Oh, God, Teams. Okay. Hi, everybody. Wonderful, Alejandro. It was great to hear this talk, and I have loved every one of your books. I guess my question is around some of the themes in this talk today, how public health and fiction can amplify each other. And it's just so clear to me that fiction in various forms, TV, so on, offers opportunities to model conversations people should have with each other about topics that are very public health oriented. How do you model having a conversation about using a condom, for example? It can be funny, it can be poignant, it can be frustrating, but modeling these interactions, telling your mom to quit smoking, all sorts of things like that, I think can be a very helpful contribution without straying too far into the preachy.
Yeah. I appreciate that observation or question. That is the part of writing when I have the manuscript that takes up most of my creative and brain powers or time. It is when I know I'm trying to communicate something that I feel is important, essential, what I would consider a public health policy or imperative, and I don't want to be preachy because I don't want to lose the reader. And in the first book, there's a section where the narrator who has gone back to his hometown um, rekindles a love affair with his high school sweetheart. And after they've had sex, they're in his bedroom and he's looking around the room and he pieces together that this young white man, he's Latino like me, but the young white man that he dated in high school, um, uh, didn't finish, barely finished high school, didn't go to college, and he owns two homes and he has this. And so he gets in his head about generational wealth, and he knows from, he tells him in that, how did you end up with this and end up with this? And the guy says, well, my uncle, do you remember so and so? He died and he left me these mid 1800 pistols, right? And I was able to sell them in these duck decoys, these mallards that were worth a lot of money. And so he was able to sell those to buy a cabin and to take his kids to Disney World. And here he is thinking, I and so I wanted to talk about reparations, which I believe is the mother of all public health policies. I think reparations for slavery are essential. We need to do it. And I'd love to see it in my lifetime, but we'll see. And so I thought, how do I bring this up here? And so I spent a long time writing that scene in one paragraph. He makes the connection where he says, how can we still be cashing in on slavery era memorabilia in some communities, and then questioning the right for generational wealth for Black communities, that is vis-a-vis reparations. And I think reparations continues to be a hot button. It's gotten more traction over time. Some people are talking about it more logically and showing how it's feasible, and a lot of researchers, economists, but it still is not popular. And so I feel a lot of responsibility when, if I'm going to even mention it, it's got to be done in a way that is sort of irrefutable, bulletproof, you name it. I want someone to read that scene and just sort of be like, I can't argue with that, you know? And so, Amy, so whether it's condoms, whether it's this, it doesn't matter. I feel that way when I broach public health issues directly in the conversations, because it's almost like I'm having a conversation with the audience. You know, it's almost like I put myself in front of Tucker Carlson or you name it. I'm like, how would they respond to me saying this? And I need to have 3 rounds of answers ready to go. And then sometimes can I reduce that to one answer because, you know, logic works in our favor. And so those are the conversations I have with myself, and I do think about that a lot. So I'm grateful you mentioned that. I think about that a lot.
Hi, Alejandro. I have a question to piggyback off of that. I'm faculty in the department. I think we met when you were here for graduation,
Yes.
and I also have come to the sad conclusion that I'm not going to see the changes that I thought I was working for in my lifetime in public health just this last year. And, this has been a really hard year for people in public health, for people in academia. And part of my frustration is, until, pretty recently, with everything going on in Minnesota, feeling like people just were not speaking up enough, that we were not doing enough. And I wonder what you think public health people should be doing right now. What should we be saying? Who should we be saying it to? How should we be protecting what we have, and continuing to work for health justice
Yeah.
in this climate?
Gosh, I don't think I don't think I have an answer that will suffice, but I have thoughts, or just wishes. They're wishes more than thoughts. And every day, I'm like, should we get on a bus and go to Minneapolis? I say to my husband, should we just go? Because they need as much
Yeah.
backup as they can get, right? Like, they're teaching us, but they also need our support. And so I think about that, and I think about how when there are strikes, some sort of strike in an industry, there are people who don't want to strike in that industry, but they do it because they agreed to at some point that if the strike was called, they were going to do it. And I love that. Um, I don't know if I would call that solidarity, because it's it's part of like their struggle, but like when other groups kind of strike with them and join. And I wish there was something in the public health world where we'd all agree to ahead of time, like a red phone or something, where it was like, okay, this is really bad, and we're just gonna say it. We're gonna call it as it is. We're not gonna think about funding. And if we all do it at once, absolutely everyone does it, right? Then it'll work. I, During the National Book Awards 3 years ago, the previous year I had been nominated for Town of Babylon. I'm not bragging. It's relative to the story, or it's pertinent. It's pertinent to the story. Um, my Gaza had just happened in on October 7th, and the National Book Awards were on November 14th or 15th. And I thought, this is a great platform. You know, it's a massive event, black tie, um, lots of cameras, all the media outlets are there. So I tracked down every single nominee that year. I wasn't nominated in every category. And I said, would you consider when each of your category gets called, that you all go up and accept together in the name of a ceasefire? And I did that. There are 5 categories, and I asked all of them. And I sent as an image Michael Moore at the 2003 Oscars when he won for Fahrenheit 9/11. He brought up everyone with him, and they had agreed ahead of time that no matter who won, they would all call out the bullshit about weapons of mass destruction. And I was 23 at the time, and I don't know, I was so moved by that. I was so, so moved because I thought the Oscars are about like indulgence and self-importance, and so infrequently does this happen. I couldn't remember anything, like maybe before that it was Vanessa Redgrave, you know, in like 77 or something. And the fact that they had agreed ahead of time, I was like, wait a second. These warring factions, 5 nominees, they had gotten together and they had made a plan. And I thought that was so beautiful. And so I sent every one of the writers and nominees and translators a link to that. And I said, you each decide. I can help you with language if you need it for a statement, but will you each decide? Um, and so I got pushback, and I got a lot of support. And then I emailed every one of the nominees from my year, and I said, if they do this and they lose jobs or funding, can we promise to support them in some way? Like if they lose speaking gigs at that university, will you invite them to your university? And so on and so forth, like all of the things. And it took uh, you know, in the end, what the people who wanted to do it, what they agreed is that for the final award, which is fiction, everyone from all the categories would come to the stage, and one person would read a statement. It's not the statement I would have written. And it was, of the 35 nominees, 19 people went up. But on the front page of the New York Times, it looked like everyone was up there. And it was great. It was really, really, really great. Um, I wish, and I said this at the alumni impact at the graduation a few years ago. I really wish that public health schools would train us to do 85% of our work, of like the area we're going to focus on, you know? Maybe my passion is diabetes care. So we're 85%, but like 15% always has to be to systems and to like shutting off the conveyor belt, right? Because otherwise, so much of our public health work becomes about the conveyor belt, like Lucy and Ethel trying to get the chocolates. And it's like, how many people can we save? How many people can we help? How many people can we help? And so few of it feels sometimes that like, how do we sabotage the conveyor belt so it stops moving? And I know we're so hamstrung by like 501c3 laws and political this and all that other stuff, but there has to be a class, something that can be taught like at every public health school. It's like the 15% class or even the 10% class. This is how you can stay political at every organization where you're not allowed to be political, right? Something like that. There are so many radical public health workers. I see some of them on this call who were doing it anyway. And so I wondered, like, should we be gleaning it from them, or should we like in some ways try and like get it into the curriculum? I don't know. Maybe when it gets institutionalized, it loses its oomph. But that I didn't really answer your question. I'm sorry, but I got on a tangent there.
It's great. Thank you.
Alejandro, it's been wonderful to see you and to
I
hear
thought
about your journey through the past years. Thanks for the great work as a public health communicator through your artistry. It's been fun to watch. I'm curious. You have a large audience now, but have you ever tried your hand at screenwriting, screenplays, and going for that kind of segment?
but it's really great to see you. Thank you for that. I uh yes, so when the first book, I got 2 calls from and went and had and went and had a meeting at the Paramount lot in LA. And that was incredibly surreal. And then the writer's strike happened like a month later. So unlike, yes, the short answer is yes, I have an idea for two television shows, uh, some of them based on my writing. Um, it's just about sitting down and what feels like learning a new craft, you know. I'm in such long form writing mode, and I have ideas for 5 new books, and so I'm just trying really fast to get them down. But I would love to adapt my work or to write something for the screen. It has always been kind of the medium that most entranced me from a young age, and it continues to be. So that would be a dream. So thank you for that.
Great. Thanks.
We had a question from Mimi, who runs the COPHP program, about what you would say to students, because there are a couple of current students on the call. What advice do you have for people who are coming into public health grad school right now, and how do they sort of care for themselves while doing this work?
Oh, care is, like I said before, I think really keeping your community as close as possible, and and rolling up your sleeves. This is another research study, which would have to be retroactive, which I don't know if it's possible, but I have this feeling that if we had looked at the sort of minutia of immune systems for people with HIV and AIDS during the first wave in the United States, if we had looked at the people in ACT UP versus the people who were not in ACT UP and were like sort of living closeted lives, completely isolated from community, I would venture to say that the people in ACT UP were healthier because they were empowered and active and feeling that sort of sense of community and buffer from the rest. And maybe that's like a sort of an irresponsible thing to say. I don't know, but I've often thought about that. And so I guess that's my way of saying um, that rolling up your sleeves and not being afraid to get in the muck is always really great, and to do it with as many friends as possible. So my very first experience with protest, I was an undergrad, and this group of people walked by. Maybe it was like 50 people with banners saying more funding for the Africana and Latino Studies Department, more funding, and they were cheering and chanting. That was almost 30 years ago, and I feel like campuses still have that protest about Africana and Latino Studies departments. And I I was just sort of listening, and I thought maybe someone recognized me and they pulled me in, and I joined the protest. Um, and I was both embarrassed to be there because we were so small, and I felt like everyone was looking at us, and I was sort of raised to be seen but not heard, and definitely and ideally not to be seen either. And so I was like, and then also embarrassed that I didn't fully understand what I had just joined. But it seems so logical to me that, like, of course, I want more funding for these programs, and that's my friend over there. So I joined, and I felt such safety being with that group of people, you know. And so I think it's really important to not try and be a superhero, but to be part of a collective of people that like do things together. And to sometimes I would love for the revolution not to be bloody like that. I don't want to get hurt. I'm afraid of pain, you know. But I also think sometimes we just have to like lock arms with people and not be afraid of New York. And also to like not and to say those things, to call them out and say, you know, we're afraid of this, but like we need to do this. We need to be more vocal. We need to support each other. And if we're gonna protest or or call out the powers that be and risk our safety or well-being or our livelihoods, we need to make pacts ahead of time that say we will support each other, you know. Um, that sort of thing I think is important. And I was really grateful that the COPHP program lent itself to forming a community. You know, there was a lot of roundtabling about everything. And so there a lot of eye-to-eye contact and just getting to know each other and going to each other's homes. And when I came and did the book tour in Seattle a few months ago, almost everyone from my class came out. I was so moved. I hadn't even seen those people in so many years, and I was so moved by it. Um, so I think those sorts of things are important. As a side note, my mom and I used to talk, we had our weekly call when I was in college, or maybe a couple of times a week. And when I told her I had joined that protest, the first thing she said to me was, "You didn't sign anything, did you?" And I said, I lied and I said no, because I could hear in her voice it was a bad thing. But my mother came out of the sort of the just the beginnings of the Civil War in El Salvador, and my aunt was a revolutionary whose participation caused a lot of stress in my grandparents' lives. And she was right to do it, but my mom only knew the trauma of it. So we were raised to be very apolitical people. And my mother said, if you do that, they will cut your funding, they will kick you out, they will mistreat you in class, they're going to do all sorts of things to you. Don't join anything. And it's funny that to see the protests last year and in Gaza and how they've been doing that to students, people who get caught up on camera and suddenly they're like being arrested and mistreated. And um, yeah, it's quite sad to sort of be living in that moment. It shouldn't keep us from being vocal, but it is sad to see it come full circle.
Aaliyah, last question.
Yeah. Hi, my name's Aaliyah. I'm a prospective student for the COPHP program.
Whoa.
Yeah. So it's been awesome to hear just another view of like where we can use public health. So that's been super cool, and I love to hear that. Um, I guess my question, you kind of answered where I was originally going to go with what you were just talking about just now, but how do you push past that fear, especially for like me as an undergrad and as an only 20 something student? You know, I don't feel like I know enough about the world to go out and like start saying things and start making declarations, because I know that I'm still uneducated on so many topics in the world
Yeah,
and so many people's lived experiences,
yeah,
which then makes me feel a little bit helpless. So do you
yeah,
have like, either something you would tell yourself or something that, you would tell somebody else of just like where do you start?
yeah. Um, Thanks for that question. It's a great one. I I often feel like I should have started younger, fighting for there to be more lights in restaurants. Let me explain. I realize that the older you get, the worse your eyesight gets. And then suddenly you have these dimly lit restaurants that are all the fashion, but you need to hold a candle up to your menu. And if I had been more vocal about it in my 20s and maybe when I was in my 40s and 50s and 60s, this is all to say, I think that the powers that be view with more scrutiny people who are fighting for themselves, and a popular sort of society also views it that way. Like, of course you want that. It's in your interest, and people should fight for what they need and for dignity and for resources just to be. But there's solidarity is so beautiful, and sometimes I think even something that I don't know well, I can see that something is happening right there, and I have to show up because when I do that, it strengthens their movement so much, because it says that um, that it has transformed another portion of the population. So then people can't ignore it. Because I have this weird thing where I get very emotional when I see solidarity in action. It's strange. Some people like I get teary-eyed when I see someone help someone else that they don't have to be helping. I'm always like, oh my God, you're so beautiful. That's so beautiful. I think a lot of humans feel that way. And I think when we see people show up for other people, we're like, whoa, they're there too. And so I guess my answer for you is yes, always be very thoughtful about who you show up for and when you're raising your voice and for whom, but don't let the need to be fully educated on something keep you from supporting people who are desperate, who are in dire straits. And I think sometimes there's some bigger ticket, obvious stuff like police brutality, right? The stuff going on in Gaza. I mean, I think generally speaking, the info is on our side, and so um, yeah, I always do the research, but not at the cost of going out there and being supportive. And
Alejandro,
and and,
thank
and also, oh, real quick, organizations exist and they've been doing their work for a long time. So find a couple of good organizations that you respect that have an activist army, if that's the way you want to go, and show up for them because they're already doing the work.
Thank you so much. This was a dream conversation about critical thinking and communication and community organizing. And we so appreciate that you were part of our community and also part of the world at large. Thank you for
Yeah.
coming. And thanks to everybody who came.